Shay, this week I thought we'd talk about sleep because sleep affects our hormones and weight loss as well. So I love this. Is if you want to lose weight, go to bed. We want to make sure you get enough sleep. So sleep could really be one of the missing links to weight loss. And so how important is sleep, right? So sleep, what I'm finding through the research I did to prepare this talk is just so important, much more important than I thought. And so sleep is really essential. And so we spend a third of our lives sleeping, right? So you want to have about 8 hours of night of sleep. And so, 24 hours in a day, so we're going to spend, that's a third of our lives sleeping. So it must be important, right? And so they did a study. There was a study, one was done on puppies. And so if they sleep deprived the puppies, they didn't last very long. They passed away. But a more important study was done on rats, and they compared the rats. If they didn't feed them, the rats died after about 16 days. If they didn't give them anything to drink, the rats lasted about less days, so about 14 days. And if they deprived them of sleep, they passed away as well. They died after 16 days. And so sleep is just as important as eating and drinking. So I thought that was really quite interesting. And of course, sleep is going to affect our energy. It's going to affect our mood. It's going to affect, just our overall health in general. And most people have an understanding that, you need to sleep to help with healing and repair and, rest and rejuvenation, right? So it's a time for our metabolic health to also reset. And it turns out that, there's like a third to a half of all Americans that still have trouble falling asleep or staying asleep. And I definitely see that in my practice, and I make sleep one of the most important questions that I ask people, and if they're sleeping or not, and I look at their improved sleep as a guide to if they're getting better. So again, sleep is essential. It's very important for stress management. Oftentimes people that don't sleep well, they don't handle their stress very well. They get stressed out more easily. It affects our performance. And so if we're not sleeping well, then we can't perform as well. So the athletes know how important sleep is to their performance. And so if we're not sleeping well, it's going to cause more illness. And there's a lot of studies relating sleep to weight gain. And so sleep deprivation is really 6 or less hours. I talked to a patient yesterday, and she goes, I asked about sleep, and she said, well, I'm doing better than my 4 hours of sleep. She goes, oh, I'm getting 6. And so it was really like, we really need to work on your sleep. And so what are some of the symptoms of insomnia? So definitely more irritability. So if you're not sleeping well, you're going to be more irritable. I know I'm not at my best if I'm not sleeping well. Of course, you're going to feel more drowsiness during the day. You're going to have more hard time concentrating. It can affect our memory. So that's another thing with memory. Sometimes, for me as a doctor, it's like, well, if they're not sleeping well, their hormones are off. It's also going to affect your memory. So just having better sleep will not always a hormone issue. It could be more of a memory, a sleep issue. Of course, fatigue. Sometimes, if you're having a hard time getting up in the morning, maybe you're not sleeping well at night. If you're needing to use medications for sleep, and definitely see a bit of that, you're going to have more pain. So when you don't sleep well, your pain perception is less. And so you will have more chronic pain. And then, of course, for this lecture, it will cause weight gain. And so causes of poor sleep. So stress will cause us to sleep less. If you're having poor sleep hygiene, we'll be talking about some sleep hygiene things that you can do to help improve your sleep a little bit later. If you have anxiety or depression, your mind's spinning, you're gonna maybe not sleep as well. If you're working night shift, it's gonna upset that circadian rhythm, the biological clock. If you're traveling, doing across time zones, my son has traveled, he's in a 9-hour time zone difference right now. So he's 9 hours ahead. So that takes a while to get used to. Low melatonin levels. So how do we keep our melatonin levels up? So, so at night, if you have exposure to artificial light, it's going to affect the sleep hormone melatonin.
Dr. Gordon?
Yeah.
Sorry, did you notice your screen share is still stuck on the puppy? It's
What?
not changing.
Oh, it's not changing.
Usually it's not changing. It still says want to lose weight, go to bed
Oh,
on
no.
my
Oh, because
on
I'm
the screen share.
No, I've got the causes of poor sleep up.
Ah, there we go. Okay, now it does. I don't know why, but works now.
thank you. Yeah,
Thank
definitely keep me, if on my end, I'm just moving along. So if you,
Okay. It's like a cute puppy, but never mind.
yeah.
Thanks.
All right, great. So I'm switching slides now. Does anyone see that? Okay. So how much sleep do we need? So I thought this was quite interesting that, you talk about, the 8 hours of sleep. So back in the 60s, we were getting as a nation about 8.5 hours of sleep. And then in the mid 90s, Americans reduced their hours to 7.5 hours. And then in the 2000s, and it's 6.2 hours. And so our sleep has significantly reduced over time. And so I think, just like all the other things like our diet, our eating habits, and even our sleep is changing. And it's really not, kind of like the paleo diet, how it goes back to the grassroots. And so our sleep exposure to light and artificial light has really reduced our sleep, and our work has reduced our sleep even more. And so our sleep time has reduced by a quarter, so almost 25%. And yet there's a threefold increase in the prevalence of obesity. So you could say, well, we're up longer, so we're eating more. And that can have something to do with it, but I think there's a little bit more to it. And I know when the ice storm hit, we were out of electricity, and it was so nice, actually. We went to bed around 7:30, 8 o'clock, right? So you go to bed nice and early with the sun goes down, and then the house was really quiet, and the lights are out, and you just kind of go to bed. It's like really natural. And then you kind of wake up still at the same time, the 6:30, whatever it may be. And I just found that to be really kind of so refreshing. I felt so much better. And so with all this study on sleep, I'm like, come on, we got to go to bed, right? So just trying to get to bed earlier and get a better night's sleep is really important. So, and the sleep is going to affect our behavior. So, we're not, feeling as good. I know, like I can be a little bit more bitchy when I'm not sleeping as well. I can't be bothered with things. I know sometimes like I'll just, won't be as clean maybe, or, I'll just throw things around. Oh, I'm too tired. I'll get it in the morning. Definitely my diet is affected. I'm not as motivated. People get more depressed, which came first, the chicken or the egg, right? Sometimes depression can cause poor sleep, and poor sleep can cause depression. And so also poor decision making. So people will, not make the best decisions. Oh, I'll eat that chocolate cake, it doesn't matter, right? And then they've done studies on, sleep depriving college students, and they notice that they take more risks, and there's also more accidents. So it could be, maybe you're driving along and you'll be like, oh, I'm in a rush. I want to, go out in front of this other car, maybe get in, more accidents or something. So they've done studies to show that more accidents are happening with people with less sleep, people taking more risks. So there is a connection with sleep and weight. And so, of course, and so in 2007, they did a study where they sleep deprived people for 4 hours versus 7 hours versus 9 hours. And the less sleep they had, the more of these hormones that are related to hunger. So we haven't talked too much about these hormones. I thought this was a great place to bring it up. Leptin is the hormone of satiety. So when your leptin is high, that's saying that I'm full. And so when you don't sleep well, your leptin levels will be lower. And so leptin is secreted from your fat cells, and it tells insulin to, we're going to talk about it in the next slide actually, about, tells insulin to come out. And then when the leptin levels are high, then insulin can stop. But ghrelin is another hormone that tells you you're hungry. And so I think I probably mentioned it in some of the other lectures, but ghrelin is the hunger hormone. If you don't have enough ghrelin, you're going to feel hungrier. And so you're going to want to eat more. And so with not sleeping well, you're going to be hungrier, and then you're going to have a harder time feeling full. And so what they found is that people are eating more, and they required 23% more in this study. The people that slept less needed more food to feel full. So definitely affects these hormones. And so this is leptin. So in the book I mentioned last week, Why We Get Sick, there was a chapter in there, not chapter, but a few pages on leptin. And it says leptin is produced from the adipose tissue, so it's in the fat cells. And so when we eat, the leptin levels go up, and it really communicates right directly to the brain that says, okay, I'm full. And so you can develop what's called leptin resistance. And with leptin resistance, your leptin levels will increase, but it's also, you're not getting the message. And so the insulin doesn't stop going out. So you're secreting more insulin. And so also, which was very interesting, I think, is leptin affects it comes from your fat cells and affects many different organs. So it's affecting our brain, it's affecting the heart. I certainly don't know enough about leptin, but it does affect many different areas. It also affects your thyroid. In Dr. Bickman's book, he talked about puberty. And so a lot of times, kids are becoming, going through puberty a lot sooner, right? And I always thought, oh, it's the estrogen in the foods. They're becoming more estrogenic, especially for the young girls, developing puberty sooner. But it could be that the kids are just getting fatter earlier, like there's a lot more obesity in children. And so they're having a higher leptin, and leptin is also a signal for puberty. And so that's what Dr. Bickman talks about with leptin in regards to that's why one reason why kids are going through puberty sooner. So our food preferences will also be affected by poor sleep. So what do you like to eat when you're tired and cranky? I know I'll eat more cereal. I'll go to Dairy Queen maybe, so like, I know when I'm tired and cranky, not feeling good, I'm going to eat foods that are higher in calorie, higher in carbs, they're just more, seem to hit that spot, I guess. And so what they found is that there's 32% in the study, 32% increased desire for these high caloric foods. And so, of course, if you're eating more calories, more carbs, then you're going to gain weight. And so I hope to talk about this at the end, like what are you craving, and just to kind of be more aware of it and to help avoid some of these pitfalls, right? But it turns out that sometimes, sleep affects our brain. And so there's a couple of centers in the brain that worth noting, the emotional center of the brain, which is a very old, center of the brain called your amygdala. And so this part of your brain, when you don't sleep well, isn't working that well. And so it does help with appetite. So your desire is, I guess your appetite is increased. And so you don't really think about, oh, I'm just going to grab that chocolate bar, or, you just kind of go for it. And so the amygdala is the emotional center. And they talked about, like, if your emotional center is off, like you don't have much fear, you don't have, like, you're just lacking in emotion. And so your responsiveness to the foods, like, oh, I'll just grab that, I'll eat it. And, you don't feel the consequences. And then this other area of the brain called the anterior cingulate, that's a newer part of the brain. But what this one is, I really liked when I heard this, is that puts the brakes on your emotions. And so, like, if you're standing in line and like the line's not moving fast enough and you just kind of want to, scream out like, I gotta go, or, this part of your brain is the part that like kind of lets you temper your emotions. And so this area of the brain is not working as well either. And so you're going to tend to like just reach out and go for things, less break so to speak, on your food choices. So I thought that was quite interesting, just a little bit of brain science there, how it's affecting not only our metabolism and things like that, but it is affecting our brain right there. And so it does affect our metabolism as well. And so different, insomnia, which I thought was interesting here was sleep apnea. And so my mom has sleep apnea and she doesn't like wearing her CPAP, and she's hungry all the time. And there's no talking to her about it. She wants it and that's the end of it, and cake is her favorite food, and that's, she'll eat it, and that's, it makes her happy. And so I kind of understand it a little bit more. She hasn't been sleeping well for years and years. And so it's affecting her metabolism, right? And it's affecting her brain centers. Like there's really no way of like rational eating. And so it's going to affect our metabolism. And so it will affect our metabolic rate. And so what they found here is that just to get a little bit more understanding of your basal metabolic rate. So basal metabolic rate means that it takes about 60% of your calories just to run your bodily functions. And so I thought this was interesting because I always think, oh, basal metabolic, I don't really think too much about it, but it's really like your heart, your lungs, all just when you're just laying there, like the essential functions of just having everything work. And then you have another place where your metabolism is being used, and that's metabolizing the foods that you eat. So to digest foods, that's another 10% of your calories. And then it's really only an extra 30% of the calories is used for your moving around and activities, so muscle work and just functions. And so when we don't get enough sleep, our basal metabolic rate and the amount of energy used to digest foods is dropped. And so it reduces your basal metabolic rate by 10%, which can be quite significant, over the course of a year, right? And so I thought that was quite interesting. So, that's why maybe, we're giving more and more thyroid hormone, over the last 50 years, people need it more, but they also are sleeping less. So everything's kind of convoluted as to why basal metabolic rate is lower. And so then, of course, the other thing is exercise. So if you're not sleeping well, then you're really not going to be as motivated to exercise. And so you're going to also maybe not be as safe with exercise. So you might get injured more if you're not sleeping well, especially if you're lifting weights or doing high risk activities. And we all know how important it is to exercise. Muscles use up the glucose and help the insulin resistance quite a bit. And so I want to actually do a segment on exercise, and my dog's going to bark. He sees another dog. Don't bark. So when you exercise, Edie, that's going to help lower your glucose levels a little bit more and improves insulin resistance. And if we're too tired to exercise, then that's not going to get done. And I've seen this recommendation here. It says 150 minutes of moderate intensity exercise or 75 minutes of high intensity exercise a week. And I've seen that in a few different places. And so that's the recommendation. So trying to get a moderately intense walk or lifting weights or whatever it might be, just to kind of move more and think about trying to get 150 minutes a week, which that could be 30 minutes a day, right? So 20 to 30 minutes a day would be recommended. So if you don't get adequate sleep, it's going to be difficult to lose weight. Melatonin is the sleep hormone and cortisol is the stress hormone. And so if we're under a lot of stress, if we're not getting enough sleep, then these melatonin and cortisol levels get dysregulated. I mentioned cortisol in one of the other lectures, and how cortisol high cortisol will also increase your blood sugar and then cause insulin resistance. So some tips for getting a good night's sleep. So you want to have, try to have a consistent bedtime. And so if you're kind of going to bed early and late and skipping, it does cause changes in your insulin sensitivity. It's really good to get a dark room. And so exposure to light, whether it be the light even on your alarm clock, a lot of people have their phones now. So making sure the phone is kind of turned down, face down. And then also, I think it's good to have your phone in airplane mode if you're able to do that next to your bed, because then you're getting less EMF. But I know some people, well, some people in my family have the TV on all night long. That's just how they are. And it's just so bad for you, right? And so it does increase risk of obesity. So I recommend getting blackout shades. Costco has great blackout shades there. And just having your room completely dark, it really helps with sleep. It's good to not eat right before bed and to try to reduce your stress as well. I have a lot of tips. And then avoid stimulating books or TV before bed. I know sometimes if I watch something active, I try to avoid, I don't like to watch TV too late, but sometimes I do, right? But trying not to watch too much TV, all that blue light. You can wear socks if you have cold feet. Sometimes people think it's better to have like a cooler room to sleep. I know we turn our heat off at night, so it's a little, it does get cooler. They even sell cooling mats. Some people, like the biohackers, are interested. They do cooling mats. Maybe do some meditation or yoga or something relaxing before bed. You want to avoid the loud alarm clock that will elevate your cortisol. And they find that if you're an early bird, like early to rise, they find that people that are early birds, early to rise, tend to weigh less than people that sleep in late. So go to bed early, allow your body to recharge. It's good to avoid over-the-counter medications, so that can be affecting sleep. Of course, avoid caffeine. I usually tell people to have, if someone's having a hard time sleeping, no caffeine after noon, 12 o'clock. Maybe don't drink 2 hours before bed so that we don't have to get up to pee. Taking a hot bath or a shower before bed, that's my favorite. I love, usually I come home from work and I'll take a hot shower. It really helps relax me. And it does make you elevate your body temperature. And then have your bed be a place for sleep. And if you have persistent insomnia, you might want to consider getting tested. Of course, get like a sleep study done, maybe get your hormones tested and other kinds of blood work. Oh, here it is. So sleep study. Progesterone is really great for helping, it's a great relaxant. Adrenal support, melatonin, vitamin D. There's lots of different herbs that you can do to help with sleep. I do think that, as from this lecture, that sleep is so important. And I always try to make sure that my patients are getting a good night's sleep, since it is so important. And so sleep, nutrition, exercise, and hormone balance, I think they're all really important for optimizing your health. So glad you said that, because you just reminded me, because I do have something to share and I actually meant to put it in the slides. I emailed it to myself. During some research yesterday, I found a YouTube from Dr. Andrew Weil, and he did this thing on breathing, and he calls it the 4-7-8 method. And I will email that out to you guys. So it's just a YouTube, it's like just a few minutes long, but it's basically breathing in for 4 seconds, kind of with your tongue at the tip of your mouth, holding it for 7, and then breathing out with an open mouth for 8. And he says if you do 4 rounds twice a day, that can make a significant change when done consistently over a month or so, month or two. And then you can increase it to 8 rounds, twice a day at the most. And he says you can't go beyond that. I'm not sure why. So, starting with 4. So it's the 4, 7, 8. And that can be really, I think it really helps reset the nervous system.